Today I'm talking about what to do when you plan on working past age 65, when to enroll in Medicare, and how exactly to do so. So stay tuned. Hi, I'm Stephanie Apt. More and more people today are choosing to work past age 65, and we get calls all the time from people who are leaving their employer, deciding to retire, and they're trying to figure out how and when to enroll in Medicare. So that is exactly what I'll be reviewing with you today, and I'll also be sharing some very important tips that you don't want to miss that can really help to reduce any potential Medicare headaches in the future. So feel free to save this video if you think you may need it later, share it with someone you think might find this information helpful, and definitely subscribe if you haven't done so to see more Medicare videos like this. So if you're actually turning 65 and you're still working and you plan to work a bit past age 65, then you may well want to delay enrolling in Medicare Part B. And this decision to delay Part B will depend on your employer size as well as how much you're actually paying for your portion of the premium for your employer plan. And I talk about all of this in more depth in another video that I'll link up here, and you'll also find it in the description below. And that talks all about whether or not you should delay Medicare Part B depending on your situation. But in general, if you're still working, if you have a large employer with over 20 employees, and you have good health insurance through your job that you pay a relatively low premium for, then you'll likely want to delay Medicare Part B until you retire. You see, Medicare Part B isn't free. It has a monthly premium that you have to pay, and Medicare generally doesn't coordinate benefits that well with employer insurance. So for most people, it's most beneficial to delay Medicare Part B if you're going to keep your employer insurance and wait until you leave that employer plan to then add Medicare Part B, and from there potentially add on a Medicare supplement plan or a Medicare Advantage plan. So if you have already delayed Medicare Part B and now you are coming off of your employer group insurance, I'm going to talk about the important things that you need to know about exactly how and when to enroll in Medicare using your Part B Special Enrollment Period. First of all, you can enroll in Medicare Parts A and B anytime that you have active job-based insurance, and up to 8 months after you leave that active job-based insurance coverage. And this can be insurance through your job as an active employee or through your spouse's employer if they are an active employee. And COBRA coverage and retiree benefits don't count. In most cases, you should enroll in Medicare A and B before you leave your employer coverage so that you avoid a lapse in coverage. There are a couple different ways to sign up for Medicare Part B using your special enrollment period. The most common way that we've usually recommended is submitting these two forms to your local Social Security office, and you can go ahead and bring them down to your Social Security office in person if it's open. You can also mail these forms into your local Social Security office. So the two completed forms below, which is the CMS 40B, which is your Medicare enrollment form, and the CMS L564, which is the request for employer information. On the CMS 40B form, you can write in the comment section when you would like your Medicare coverage to begin. And on the other form, the request for employer information form, it requires a signature from your employer stating that you've had creditable coverage so that you avoid any potential Medicare penalties. With COVID restrictions now in place at Social Security offices all over the country, people have been mailing these forms in more frequently, and you can go ahead and check the status of your Part B enrollment on your myssa.gov account. So this is a really handy account for you to access. You'll be able to see your Medicare acceptance on that account by clicking on the benefits determination letter, And you can view that usually at least 2 weeks before you actually receive your Medicare verification letter in the mail. Another newer way to apply for Medicare Part B with your special enrollment period is to go ahead and apply online. So this is new as of last year when COVID restrictions were closing down Social Security offices and employer offices. And you can now go ahead and apply for Medicare Part B online, and you can upload proof of your special enrollment period. And this can be really handy for people that are maybe having trouble getting their employer to sign that employer verification form, or simply people that prefer to do things online. I am going to link the exact website you want to go to apply for Part B online with your special enrollment period. I'm going to link that in the video description below. And in order to apply for Part B online, it will ask you for your Medicare number. It will ask you for a current valid email address. It will ask for your mailing address. And it's also going to ask for proof of your employer group coverage that you're coming off of. So you do have to upload that proof, and then you will digitally sign your Part B enrollment application. And usually it works best if you're using Google Chrome or Microsoft Edge. Similarly, once you've completed the enrollment, you can go ahead and check your status on your myssa.gov account. So you can go ahead and use either of these methods to enroll if you're enrolling in Medicare Part B upon retirement. And Medicare must honor your special enrollment period as long as you provide them either that signed employer form or proof of your prior employer group coverage. Now, an important tip that I want to share is when you are leaving your employer group plan, be sure to save any correspondence that they send you regarding your notice of creditable coverage. You see, when you sign up for Medicare, now that you're leaving your employer group plan, you're probably going to sign up for either a Medicare Part D standalone drug plan or maybe a Medicare Advantage plan that includes drug coverage. And Medicare Part D is not made aware of your prior creditable coverage. So what will very commonly happen is your Part D insurance carrier will send you a letter requesting that you submit to them the notice of your prior creditable coverage so that you can avoid any late enrollment penalties. So be sure to keep an eye out for that notice and save it once you receive it. It can definitely help you to avoid future confusion and headaches later on. In general, I hope this video helped to explain how and when to enroll in Medicare Part B using your special enrollment period if you are retiring or coming off of your employer group coverage. As always, you can reach out to my team and myself with questions at any time. We're here to help. And you can also contact us to receive free, no obligation Medicare supplement quotes at any time too. Our service is completely free of charge, and we are licensed in almost every state in the country, so we'd be happy to assist. Thank you so much for watching, and we'll see you soon.